Examination of the optic nerve. The optic nerve carries messages from the retina to the brain for vision. Examination of the optic nerve includes the assessment of visual acuity, visual field, color vision, pupillary responses, and fundoscopy. Visual acuity for distant vision is measured using Snellen charts. Stand the patient 6 meters away from the chart, covering each eye separately. Find the line of print, which the patient can comfortably read at. Interpretation of visual acuity testing. The smallest line read is expressed as a fraction. Example 6/18. The upper number refers to the distance the chart is from the patient, and the lower number, usually written next to the line on the chart. Visual acuity for near vision is tested by a Jaeger chart that has paragraphs of text printed, with increasing text sizes. The smallest print that the patient can read determines their visual acuity. Causes of decreased visual acuity include papillitis, retrobulbar neuritis, refractive errors, and primary ocular disorders like cataracts. Assessment of the field of vision includes confrontation method, red pin method, and perimetry. Confrontation visual field testing involves having the patient looking directly at your eye or nose and testing each quadrant in the patient's visual field by having them count the number of fingers that you are showing. The patient must be able to give a correct response in all 4 quadrants tested. Red pin test for the assessment of blind spot. Sit directly opposite the patient at a distance of around 1 meter. Ask the patient to cover one eye with their hand and focus on part of your face and not move their head or eyes during the assessment. Place a red hat pin, equal distance from the patient and you. Slowly move the pin laterally until the patient reports the disappearance of the top of the hat pin. The disappearance of the hat pin should occur at a similar point for you and the patient. After the hat pin has disappeared for the patient, continue to move it laterally and ask the patient to let you know when they can see it again. The point at which the patient reports the hat pin reappearing must coincide with yours. An enlarged blind spot is typically associated with papilledema caused by raised intracranial pressure. Perimetry. Perimetry is the systematic quantification of the visual field. The 2 most commonly used types of perimetry are Goldman kinetic perimetry and threshold static automated perimetry. Assessment of color vision. Color vision is tested in each eye by the use of Ishihara plates. Ask the patient to cover one of their eyes and read the numbers on the Ishihara plates. The first page or the test plate assesses contrast sensitivity. Once the test is complete, you should document the number of plates the patient identified correctly, including the test plate, for example 13/13. Most common anomalies of color vision are the various types of red-green deficiency. Acquired defects of color vision occur in macular and optic nerve diseases and due to certain drugs, like ethambutol, chloroquine. Pupillary responses are assessed using direct pupillary reflex, consensual pupillary reflex, and swinging light test. Fundoscopy. An ophthalmoscope is used to assess the optic disc and retina while the patient is looking into the distance. Fundoscopy can help identify endocarditis, disseminated candidemia, CMV in an HIV-infected patient, and stage diabetes and hypertension. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.